the globe, glimmers of hope as we race to flatten the curve here in the United States and in Arizona. It is progress, but is it enough to reopen the country? Nick Saletti spoke with former Health and Human Services Secretary Donna Shalala recently to get her take on what our next steps should be.
We're not in control. It's leveling off in some places, but it's very dangerous to move too quickly.
Donna Shalala now represents South Florida in Congress, but in the 90s, she was in President Bill Clinton's cabinet, the longest-serving Health and Human Services Secretary in our nation's history.
This is about precious lives, which we can save.
But with staggering unemployment numbers, small businesses struggling to stay afloat, and consumers losing confidence, President Donald Trump says the economy should reopen sooner rather than later.
Of course we want to open up the economy, but we've got to base it on data and on facts. It's not about the date, it's about the data.
Shalala explains there are many pieces to this puzzle, and one in particular is still missing.
Testing. They've got to have a strategy for testing a wider group in the population. That testing has to be almost everybody over 65, by the way, in their communities. We've got to get control over the terrible deaths in our senior citizen housing complexes, in nursing homes, in assisted living facilities. That's very important for Arizona.
But how do we get those tests? Shalala suggests more public-private partnerships may be the best and quickest avenue.
The federal government has the resources, and it's got to incentivize the private sector.
And a final reminder, as we battle against this global health crisis, we have the power to help stop the spread.
We're in this together. We're the United States of America.
And that was Nick Saletti reporting. Representative Shalala and several other members of Congress introduced their own bill last week to reopen the economy.